Hello, I'm Dr. David Roberts from Manchester West Veterinary Hospital, and unfortunately today we're here to talk about one of the diseases that we see more and more often as a veterinarian, and that is the C word, cancer. It's the word we always whisper, but it's something that we as veterinarians need to make sure that we are looking for because it is out there and it's very, very common. We're going to kind of cruise on over to Cruiser here and kind of show you the 4 different spots where we see cancer. One is, it's going to be the integument. It's going to be his skin, eyes, and sometimes even his oral cavity. So that's the one spot that we will find cancerous processes. The second spot is in the thorax, in the chest, here in the lungs, sometimes even in the heart. It happens with our canine and feline patients pretty much all of the time. The third one is in his belly, in his abdomen. And that is something that we actually have a little bit better outcome when we start to treat cancerous processes. And the fourth one is actually in the lymph nodes. There are lymph nodes here, 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 in the armpit, in the groin. And those lymph nodes actually sometimes will get cancer, and that is actually one of the better cancers for our canine patients. So when we look at cancer, we have to think of 2 different things. One is, if we need to treat it, we need to decide if it's going to be something that needs to be treated locally, such as surgery, and we put an x-ray up here, and this is a little bit upside down, but this is the heart of the dog, but this is actually a tumor that is in the dog's spleen. We were able to go in and do surgery and remove that tumor, and that dog is doing fine, and is doing fine for years afterwards. So it's certainly something that becomes a local type of tumor. Now, when we have a dog that has a skin tumor, we actually can go ahead and remove that, again, surgically. But sometimes dogs have tumors and cats have tumors that are actually spread throughout the body. Those dogs do need chemotherapy. Chemotherapy is actually, it's got a bad connotation for human medicine, but what I tell clients is that dogs tolerate it very, very well. And we have even had our own Bouvier, Brianne, who was Cruiser's predecessor. She actually had lymph node cancer that was there for a good 1.5 years, and she did very, very well with chemotherapy. When we start thinking about cancer in dogs, it's a big subject, and it's certainly more than I can cover in this particular segment. I kind of show these books that are basically textbooks that are just huge, that have all of the different things that we do have at our disposal. One of the things that I do tell my clients is that we're not going to do chemotherapy or radiation therapy or surgical procedures that are going to be unsuccessful. What we try to do with our patients, with our dogs and our cats, is we try to make them comfortable, we try to extend their life, and we try to make them live longer and healthier through the various things that we can do. So that is how we look at cancer in a dog or a cat. And I think that even board-certified oncologists that are, that are specialists in this field, they would agree that that's kind of how we approach things. I'm Dr. David Roberts from Manchester West Veterinary Hospital. Thank you.